Guys, hi, welcome to Unacademy. This channel is Unacademy Future Doctors, and I'm your educator for biochemistry, Dr. Shivangi Shukla. Let me just check if I'm visible and audible to all of you, and if the live stream has started. Give me a few minutes to check if the live stream has started. Good. So, this is part of a series called Focus MBBS Prof 1 and Prof 2, where we shall be discussing the important topics on the for the of the entire syllabus of biochemistry, and we'll be focusing on comprehension based learning. We'll be understanding each and every aspect in detail. So I'll be breaking down each and every topic into subtopics, and I'll take up each subtopic in different classes, and I'll make sure that you guys understand the concepts behind them. Okay, so that there is no need for rote learning. Okay, because once you understand the concepts, all you need to do is you need to just brush up the terms and all that. You have to remember the concepts will be ingrained in your memory. Okay, so let us begin. We have completed about two sessions of lipid, I think, in this session, in this series. 4 classes for proteins and 3 classes for carbohydrates as well. Let me just brush up the different types about the different types of subscriptions available for NEET PG on Unacademy. There are 2 types of subscriptions, Plus as well as Iconic. The Plus subscription comes with access to videos from top educators across the country. You get to access live quizzes, tests, question banks of around 25,000 questions and more. And also, you will access printed notes in PDF format. The Iconic subscription comes with access to video lectures and printed notes from Prep Ladder as well. All right. Whatever subscription you wish to take, do not forget to put in the educator code DRSHUKLA for additional 10% discount. Okay, Dr. Shukla is the code. All right, Jatin. Hi, Jatin. Jatin asks, which date will I start clinical biochemistry from? Jatin, the schedule for this week was already fixed. So because I had already put up the sessions for this week, so from the 10th, that is from Monday, on Monday I'm going to take because you're going to have your professional examinations from 14, right? So from Monday or maybe Sunday, if it is possible, I'll take a marathon session on clinical biochemistry as well as metabolism. Okay, because you wanted a session on metabolism, so I'll take a marathon session for about 1 or 2 hours on metabolism. On that session will be on Unacademy. Okay, I told you that session will be on the Unacademy app, and the clinical biochemistry session I'll put up on YouTube. Okay, you'll get the notification in prior, and that will I have noted down your doubts, and I know I'm going to take that up before the 14th of January. Okay, I think by 10th of January I'll take that class. Okay, do not worry, and I'll make sure that during the class itself you learn as well all the concepts. Okay, especially metabolism, very very important. You'll revise in one go, and clinical biochemistry also. Do let me know the topics that you want to be included in clinical biochemistry. I'll make sure that I include those topics. Okay, please tell me in the comment section here only what all important topics you want to be included in clinical biochemistry. Okay, you tell me right now and I'll take note of that. Okay, now by then, in the meanwhile, let us start with cholesterol. Yesterday we had a brief discussion about the different types of lipid molecules. Okay, so we discussed what amphipathic molecules are, right? What are amphipathic molecules? Amphipathic molecules are those that have both hydrophilic as well as hydrophobic phases. Isn't it? They have both hydrophilic as well as hydrophobic phases, isn't it? So, this cholesterol, most of the steroids, and since cholesterol is a type of steroid, So this cholesterol is also an amphipathic molecule. It has both a hydrophilic phase as well as a hydrophobic phase. Okay. Now, what are the functions, important functions of cholesterol in the body? Cholesterol is important for steroid hormone synthesis like the sex hormones, adrenocortical hormones. Okay, and a lot of hormones involving the steroid ring. Okay, and it is an important concept of biological membranes, cell membranes. It is an integral component of cell membranes. Bile acids, very important. Cholesterol is used in the synthesis of bile acids. Okay, we'll read how cholesterol synthesizes bile acids. In this session, we are only going to read about the synthesis of cholesterol and the synthesis of bile acids. Okay, the applied aspects we are going to read later on. That is why I am taking each and every topic slowly here, because I need to ensure that you're understanding everything, the intricacies, the important aspects. Okay, the rapid sessions we have already done in super fast series. Now is the time to sit back, to ponder, to understand why such and such reaction occurs. Okay, all right. So as we have already discussed, we should know the site, the compartment in which a particular reaction takes place, in which a particular synthesis or cycle takes place. Cholesterol synthesis takes place in the extra mitochondrial compartment. Extra mitochondrial compartment, that means outside the mitochondria in the cell, that is in the cytosol and mainly in the membranes of the endoplasmic reticulum. Okay, so cholesterol synthesis mainly takes place in the membranes of the endoplasmic reticulum. Okay, and what are the sites? What are the organs where cholesterol synthesis takes place? In all the nucleated cells. So will it take place in the mature RBC? No, because it is enucleated. The mature RBC is enucleated. It will not take place in the enucleated cells. So cholesterol synthesis takes place in all the nucleated cells. About 10% of the cholesterol synthesis takes place in the liver and 10% in the small intestine. So you see, out of all the nucleated cells in the body, about 10% takes place in the liver and another 10% in the small intestine. So this is a huge amount, isn't it? Okay. Now, these 5 are the steps of cholesterol synthesis. Just look at this. I am going to read each and every term, and each and every term, whatever I have written, only contains keywords. Okay, so these keywords you should know and you should include in your answer. Okay, synthesis of mevalonate from acetyl CoA. This is the first step. What is the first step? Synthesis of mevalonate from acetyl CoA. Okay. The second step is formation of isoprenoid units from mevalonate. Alright. Formation of isoprenoid units from mevalonate. This is the second step. Alright. What is the third step? 6 isoprenoid units condense into squalene. Okay, 6 isoprenoid units condense into a structure called squalene. Then squalene cyclizes into lanosterol. Okay, the important terms: cyclization, condensation, synthesis. Again, synthesis or formation. 6 isoprenoid units. Then conversion of lanosterol into cholesterol. Okay, you see, all my notes are in a tabular format or an objective format, note-wise format. Okay, they don't have extra words or any extra unnecessary information. No, because that is only going to confuse us. We're not writing books here, right? We're not trying to increase the size of the PPT or increase the length of the video. No, what we have to do is to include only to separate the wheat from the chaff. That is what we are doing. Okay, all this is important. This is not husk or chaff. This is wheat. This is important stuff. Only this is to be learned. Okay, because if we focus our energies on learning something that is not going to be of value, that is not going to pay dividends, then it is going to be a waste. All right. So let us start. What is the first step? The first step of synthesis of cholesterol was synthesis of mevalonate from acetyl CoA. Isn't it? Synthesis of mevalonate from acetyl CoA. And where is it occurring? It is occurring in the membranes of the endoplasmic reticulum. Isn't it? It is occurring in the membranes of the endoplasmic reticulum. Now, how does it occur? Two acetyl CoA molecules will be acted upon by the enzyme thiolase to form acetoacetyl CoA, which will be acted upon by the enzyme HMG CoA synthase to form HMG CoA molecule. Now, if you have followed me from the super fast series, does all this ring a bell? Have you seen all these somewhere else? All these intermediates have you seen somewhere else also? Acetyl CoA, acetoacetyl CoA, HMG CoA synthase, HMG CoA. Have you seen them somewhere else or not? We have seen them in ketogenesis, isn't it? All these steps are similar to ketogenesis. Okay. Thiolase is the enzyme involved there. HMG CoA synthase is the enzyme involved here or involved there also. But in cholesterol synthesis, HMG CoA reductase is the star enzyme, the rate limiting enzyme that will come in to synthesize mevalonate from HMG CoA. Okay, this HMG CoA reductase is the target of the most important and most famous cholesterol lowering drugs, that are statins. Rosuvastatin, atorvastatin, simvastatin. All these statins lower cholesterol by inhibiting the rate limiting enzyme, that is HMG CoA reductase. This rate limiting enzyme will be inhibited. This step will not occur. When the rate limiting step is inhibited, what have we learnt in enzyme kinetics? It will stop, it will inhibit the whole reaction. So, cholesterol synthesis is inhibited. Okay. Now, what is the enzyme that comes into picture in ketogenesis from here? The enzyme is HMG CoA lyase. Okay. And that enzyme occurs in the mitochondria. Ketogenesis occurs in the mitochondria. Okay, and this occurs in extra mitochondrial compartment. So you see how the reactions are compartmentalized inside our body. Same substrate, same intermediates are being acted upon by different enzymes in different compartments in real time at the same time to form different products. Okay, now whenever the body is in starvation, what happens is the body wants to secrete more of ketone bodies. The body will want to secrete more of ketone bodies, and so the HMG CoA will be diverted towards ketogenesis, and HMG CoA reductase will be inhibited. Understood? So, have you paid attention to what I have told you? If you have, then you will be able to tell me how HMG CoA reductase molecule is stimulated by insulin, HMG CoA reductase enzyme is stimulated by insulin, stimulated by thyroid. We know insulin is an anabolic hormone. It is an anabolic hormone. So, it will stimulate HMG CoA reductase to form the molecule that is cholesterol. Okay. Now, glucagon will inhibit HMG CoA reductase. Glucocorticoids, cholesterol and mevalonate all will inhibit HMG CoA reductase through feedback inhibition, because these are the products of synthesis. Okay, so they will inhibit bile acids also, because bile acids are also synthesized from cholesterol only. So through feedback inhibition, they will inhibit this. What about starvation? Tell me, any of you in the comment section. I have already told you how starvation inhibits HMG-CoA reductase. How does it inhibit HMG-CoA reductase? Tell me in the comment section, because I have already told you this. I want to see the answer. Tell me, guys. Tell me, all of you. No? What happens is starvation is going to, when there is starvation, there isn't a steady supply of glucose inside our body. Okay, so what happens is the body shifts its focus towards utilizing glycogen for glucose. Now when all the glycogen stores have been exhausted, the body will shift towards its starvation source of energy, that is, what is it? Ketone bodies. And in ketogenesis, what happens is the HMG CoA here has to be shifted towards the mitochondria to be acted upon by HMG CoA lyase to produce acetoacetone, acetoacetic acid. Then beta hydroxybutyric acid, and this can interconvert into spontaneously into acetone, the third keto acid. Got it? Understood? Okay, now the second step is how mevalonate is going to form isoprenoid units. What are these isoprenoid units? Isopentyl diphosphate, which can spontaneously isomerize, which will isomerize into another isopentyl unit, dimethyl diphosphate. 3,3-dimethyl diphosphate. Okay, so mevalonate will first form mevalonate 5-phosphate, then mevalonate 5-diphosphate, mevalonate 3-phospho-5-diphosphate. These are the intermediate terms wherein the products wherein the phosphate group is being added. Okay, high energy phosphate group, and now it changes into isopentyl diphosphate, which is an isoprenoid unit. Then it changes into dimethyl diphosphate. Okay, now what happens is this 3,3-dimethyl diphosphate molecule will combine with isopentyl diphosphate to form an intermediate 10-carbon compound called geranyl diphosphate. Okay, now isopentyl diphosphate will again combine with it to form an intermediate farnesyl diphosphate. Now, two farnesyl diphosphate molecules will condense. They will condense to form one molecule of squalene. So, the third step was 6 isoprenoid units condensed to form squalene. Can you count and tell me how there are 6 isoprenoid molecules? Tell me. Here what happens is mevalonate gets converted into isoprenoid. Now, this is the third step where 6 isoprenoid molecules are condensing to form squalene. Can you guys tell me how there are 6 isoprenoid units? Can you count and tell me? Tell me. Anyone? I'm giving you a minute to think and tell me. No one? Come on guys, you just have to count. I have already told you how these are mevalonate units, how they are formed, isn't it? Sorry, the isoprenoid units from mevalonate. This is one isoprenoid unit, it gets converted into another unit. Okay, so you can at least 2 you can count, 1 and 2. Okay, so 1, 2, then 3, this is the third isoprenoid unit. Then what did I tell you? This will combine with this again. So this one is the fourth, that is Isopentyl diphosphate is the fourth one. Okay, got it? Then this farnesyl is the fifth one. And what did I tell you? 2 farnesyl molecules will condense. So 5 and 6, isn't it? 1 dimethyl allyl diphosphate, 2 isopentyl diphosphate, 1 geranyl diphosphate, and 2 farnesyl diphosphate. These are the 6 isoprenoid units that will condense into a molecule of squalene. This is the third step. Okay. What is the fourth step? Squalene will form squalene epoxide through the action of epoxidase enzyme. Squalene epoxidase enzyme. Squalene will convert into squalene epoxide. Now through a cyclase enzyme, remember what did I tell you? Cyclization of squalene. Isn't it? Cyclization of squalene is what I told you. So this cyclization of squalene is brought about by the cyclase enzyme, and this cyclase enzyme will form lanosterol. Okay. What is the fifth step? Lanosterol will form intermediates that are zymosterol, desmosterol. Desmosterol is 24-dehydrocholesterol. What is desmosterol? 24-dehydrocholesterol. Then 24 reductase, delta 24 reductase enzyme will come in to reduce this into cholesterol. Got it? Conversion of lanosterol to cholesterol through intermediates. Two important intermediates are zymosterol and desmosterol. For MCQ purposes, you should know that desmosterol is 24-dehydrocholesterol. Okay, for MCQ purposes, you should know. So quickly, let us revise these steps. 2-acetyl CoA will form acetoacetyl CoA, then HMG CoA, then HMG CoA reductase is the rate limiting enzyme forming methylonate. HMG CoA reductase is stimulated by anabolic hormone insulin and thyroid. It is inhibited by statins. It is inhibited by glucagon, glucocorticoids, cholesterol, methylonate, bile acids, and starvation. The second step is methylonate will form isoprenoid units. 6 isoprenoid units will condense into squalene. Squalene will cyclize into lanosterol. Lanosterol will convert into cholesterol through intermediates like zymosterol and desmosterol. Okay. Next we'll read about, so this was all about cholesterol synthesis, isn't it? This was all about cholesterol synthesis. Next we are going to read about bile acids. Okay, what are bile acids? They are formed from cholesterol, isn't it? Now you guys tell me if it is clear with you or if I'm going too fast. Am I going too fast? Should I just revise the cholesterol synthesis once again? You can just revise these 5 steps. What are these 5 steps? Just look at these ones. Speak them out, okay? Because it is very important for you guys to remember cholesterol synthesis. Cholesterol synthesis is extremely important. So do remember about cholesterol synthesis. There are 5 steps of cholesterol synthesis. Okay. Synthesis of methylonate from acetyl CoA. Formation of isoprenoid units from methylonate. 6 isoprenoid units are going to condense into squalene. Squalene will cyclize into lanosterol and lanosterol will convert into cholesterol. Alright. The first step involving the rate limiting enzyme, that is HMG CoA reductase, is extremely important. You should know how HMG CoA reductase is stimulated and inhibited by different hormones and substrates. Okay, feedback inhibition by cholesterol, methylonate, glucocorticoids and bile acids. Very important, starvation inhibits HMG CoA reductase. How? Because it shifts the balance, shifts the equilibrium towards ketogenesis, which are the source of energy in starvation. When all the glucose has been exhausted, all the glycogen stores have been exhausted. Okay. So these are the important points about cholesterol synthesis. You can just go along with this. You should know all the 6 isoprenoid units that I have mentioned, because I have eliminated all the unnecessary stuff. Only the important stuff I have written down, which will be absolutely important for you to remember. Okay, cyclization of squalene into lanosterol, cyclization, condensation of 6 isoprenoid units into squalene. Now we'll come to bile acids. There are 2 types of bile acids. A general classification: primary and secondary. Primary are those that are formed from cholesterol, and secondary are those that are formed from primary. Okay. The secondary bile acids will be formed by the action of bacteria in the small intestine on the primary bile acids. Okay. What are the different reactions that the bacteria make the primary bile acids undergo? The bacteria act on these, the small intestinal bacteria act on the primary bile acids and perform conjugation and alright, we are going to learn about this, isn't it? Yeah. We are going to learn about this. It forms deconjugation and, it causes not conjugation, deconjugation and dehydroxylation. The small intestinal bacteria causes deconjugation and dehydroxylation of the primary bile acids to form the secondary bile acids. Okay, by the small intestinal bacteria. What do? Deconjugation and dehydroxylation. Now we'll learn how the primary bile acids are formed. The primary bile acids are formed when cholesterol undergoes 7-alpha hydroxylation. What is the enzyme? 7-alpha hydroxylase. This 7-alpha hydroxylase will add a hydroxy group on the 7th alpha carbon of cholesterol. Okay, 7th alpha carbon of cholesterol will have one hydroxy group added because of the enzyme 7-alpha hydroxylase. So what will it form? Very easy and obvious, 7-alpha hydroxy cholesterol. Okay, now again it will be hydroxylated at 12-alpha position to form choline CoA and chenodeoxycholine CoA. These are the precursors of the primary bile acids, choline CoA and chenodeoxycholine CoA. Okay, this choline CoA will combine with taurine and glycine. These are amino acids, taurine and glycine, to form taurocholic acid and glycocholic acid. Again, chenodeoxycholine CoA will combine with taurine and glycine to form taurochenodeoxycholic acid and glycochenodeoxycholic acid. Now, what are these 4? Come on, you can speak along with me. If you speak up or if you write it down, then it will be ingrained in your memory. Okay. So, taurocholic acid, glycocholic acid, taurochenodeoxycholic acid, glycochenodeoxycholic acid. All these 4 are the primary bile acids. What are primary bile acids? That are formed directly from hydroxylation of cholesterol in the intestine. Okay, now by the dehydroxylation and deconjugation of the primary bile acids, what forms is deoxycholic acid and lithocholic acid. And what are these 2? They are the secondary bile acids. What are secondary bile acids? They are formed from primary bile acids. Okay, understood? Now, out of all these 6 bile acids, that is the 4 primary acids and the 2 secondary acids, this lithocholic acid does not undergo enterohepatic circulation. Rest all will be recycled in the enterohepatic circulation. This is going to be excreted. Understood or not? Okay, so this is all for today. I'll just put up the bile acid synthesis once more in focus for you, this slide. Just read this for 1 or 2 minutes and then we'll wind up. Okay, bile acids synthesized from cholesterol. Cholesterol converts into primary bile acids to the intermediate 7-alpha hydroxycholesterol, choline CoA, chenodeoxycholine CoA, which will form taurocholic acid, glycocholic acid, taurochenodeoxycholic acid, glycochenodeoxycholic acid. All these are primary bile acids. They will be acted upon by small intestinal bacteria. They will undergo deconjugation and 7-alpha dehydroxylation to form deoxycholic acid and lithocholic acid. Now, lithocholic acid and deoxycholic acid, both of these are secondary bile acids. Lithocholic acid does not undergo enterohepatic circulation, it is excreted. Rest all of the five, all of them undergo enterohepatic circulation. Okay, now I hope it is clear with you guys. So we have finished with cholesterol. Now tomorrow we are going to meet first of all we're going to meet for a motivational session in the evening. You would be getting a notification if you have subscribed to this channel, and at 9 p.m. a very interesting and unique session, that is integrated biochemistry and physiology, we'll take together. Okay, I'll be your educator for biochemistry in that, and Dr. Sheetal will be your educator for physiology. That will be a 1 hour long integrated session. We're going to come up with more such sessions for you to have an application based learning, where you will juggle and exercise, make you exercise your gray cells to hop on from one subject to the another, covering the same topic in various subjects. Okay, so that is going to increase your analytical and application skills. Alright, so see you guys tomorrow. Do subscribe to this channel for regular updates and notifications so that you don't miss the live classes, because during live classes you get an opportunity to put in your doubts as well. Okay, if you haven't followed me on Unacademy, please do download the Unacademy app. Look up for Shivangi Shukla under NEET PG category, and you can follow me there. I regularly post updates about my classes. I'll be starting with the classes in this new year on Unacademy's app as well. Special classes, a lot of special classes are going to come your way, including MCQ sessions for regular testing. And YouTube as well, I take daily about 2-3 classes daily I'm taking. So please follow me, so that it is going to be a win-win situation for you, because you're not paying for any of it, and you're going to you are having an access to so many doubt solving sessions, isn't it? So please subscribe to this channel and do share it amongst your friends, so that we have even more interactive learners on this channel. All right, see you guys. Good night. Bye bye.